Hi, and welcome to Monitoring and Evaluation of Sexual and Reproductive Health Programs in Low and Middle Income Countries. I'm Dr. Nirali Chakraborty.
I'm Dr. Rebecca Firestone. We're really happy to have you here with us, and we hope that by designing this course from the point of view of researchers, which is what we are, based in an implementing organization, that we're going to give you a unique point of view on some core competencies in international or global public health. We're going to provide you with an array of real-world examples from our own work and from the work of our colleagues. We both work for an organization called Population Services International, which is a large global health NGO that works in over 60 middle-income countries and low-income countries in Africa, Asia, and Latin America. PSI, the organization that we work for, does behavior change communication programs and health services delivery in sexual and reproductive health and a variety of other areas.
So over the 10 weeks that we'll be together in this course, we hope that you'll develop a solid understanding of the major issues in sexual and reproductive health, as well as the tools for designing, monitoring, and evaluating your own programs. The course that we've designed is divided into 3 parts. In the first third of the course, what we'll do is we'll outline 4 major areas of sexual and reproductive health, including important issues, indicators, and frameworks for how to think about them. Following that, we will delve into an array of interventions available to public health practitioners to try to deal with some of the problems that we've described. And in the last third of the course, we'll delve more deeply into how to monitor and evaluate programs and how to use the data from monitoring and evaluation to improve upon the programs.
We have 4 learning objectives that we'll be able to achieve with you over the course of this class. And they are that you will be able to apply global policy frameworks and intervention theories to conceptualize and plan a sexual and reproductive health program that's designed to operate in a low or middle income country environment. That you'll be able to describe a theory of change for a sexual and reproductive health program. That you'll be able to formulate a logical framework and a monitoring and evaluation plan for that particular program that will meet international donor standards and be in line with global policy frameworks in sexual and reproductive health. And lastly, we are hoping that you will be able to demonstrate a capacity to use data for programmatic decision-making within the context of a sexual and reproductive health program.
So let us tell you a little bit more about ourselves. I've worked for PSI for about a little more than 4 years now. I'm the research advisor for reproductive health, overseeing all of our reproductive health research in these countries in which we work. And prior to that, I've worked with the World Bank and with health financing consultancies in a lot of different low and middle income countries. I was trained at Johns Hopkins in international health with a specialization in health systems, and that's really where my interests lie.
I'm a senior research advisor with PSI's Strategic Research and Evaluation team, and I've also worked with PSI for about 4 years. I'm trained as a social epidemiologist, and I did my training at the University of Washington and at Harvard University. And I have worked in reproductive health since the beginning of my career, but I started out working more in the policy advocacy part of reproductive health, working at a global level, where I was involved in lobbying the U.S. government and UN agencies to apply rights-based frameworks to design reproductive health policies for low and middle income countries. And as I was doing that policy work, I became fascinated with how evidence gets translated into policy and how that can be how evidence is powerful for influencing policy decisions. And that led me into a track to social epidemiology to be able to contribute evidence that will influence programmatic decision-making and also policy decisions.
Well, welcome to our class. We're really excited to have you here, and we hope that we will engage in a good learning journey together over the next 10 weeks.
And we'll look forward to talking with you online.